Hello everyone. Welcome to the course cancer from USU. Today we would like to talk about the effect of exercise in several cancer conditions. Uh, this is our learning outcomes. So after this session, we hope that you are able to analyze molecular and physiological adaptation of regular exercise for cancer patients, and these are our objectives. So we hope that students know about the prevalence of cancer nowadays due to sedentary lifestyle, can mention several risk factors of cancer, can explain the physiological adaptation of exercise to cancer, including the molecular response of exercise to cancer. And finally, we hope that you can analyze the effect of exercise and physical activity to cancer patients. Now, let's start to the topic. Nowadays, we know that cancer is become the second leading cause of death in wide world. That most of the risk factors are modifiable, such as tobacco cessation, alcohol use, dietary risk, high body mass index, drug use, and low physical activity. These are modifiable anyway. And we see here that a low physical activity lead to the risk factor for colon and rectum cancer. These two of cancer, colon and rectum cancer, now found under 40 years of age people. Before, we know that colon and rectum cancer incidence found for people above 40 or 60 years old, but now under 40 years old, we found someone get colon and rectum cancer. And if we see the distribution of cancer based on sex, we see here that respiratory cancer and also prostate cancer found mostly in male than female. Jadi, so more male than female get respiratory cancer. But in female population, we saw that breast cancer and ovarian cancer become popular. So in general, what cause of someone, what is the factors can cause someone get to cancer? Cancer burden attributable broadly can divide it into behavioral, environmental, occupational, and metabolic risk factor. Behavioral risk factor related with lifestyle, such as smoking, cessation, sedentary lifestyle, unhealthy diet, alcohol use, drug use, and so on. And environmental, it can be related with pollutant, such as air pollution, water pollution, radiation, sun exposure, or food preservative and other carcinogenic materials can make someone get a higher risk for cancer. And what about the occupational? People who work in mining, like coal mine, and then asbestos or sex commercial. These people are vulnerable to get the cancer due to the exposure of the mining materials. If it inhale and enters to the respiratory tract system, it can be modified the pattern of cell, so the proliferation of cell become abnormal, and so does the viruses. Someone who is in commercial sex get viruses. The virus can modify the proliferation of cell become abnormal, so it become dysplasia or metaplasia. And metabolic risk factors Disruption of carbohydrate metabolism. It leads to insulin resistance, which in turn induce the inflammatory cytokine, and it enhance the increasing of people risk to cancer. Now let's have a look how is sedentary lifestyle or sedentary behavior to cancer. Previous studies found that sedentary behavior has positive correlation with cancer. If someone is physically inactive, we saw that there is no balance between intake and output energy. So the excessive of energy can be stored at the adipose tissue. So the adiposity become increasing and the accumulation of fat cell in our body of visceral fat, it can induce the metabolic dysfunction, insulin resistance, and also promote the inflammatory cytokine release from the fat such as TNF alpha, interleukin 6, CRP, and all of these can enhance the cancer development and progression. And also the size of fat cell, it can produce much estradiol. So the increasing of estrogen, the increasing of androgen, but the reduction of the sex hormone binding globulin protein, it also can make or promote the cancer development, especially for uh, female. Yeah, female who is the most popular cancer on female, as we mentioned before, breast cancer, ovarian cancer. It's very related with estrogen. And how is the some of the major risk factors associated with cancer? So we what we talked before about the sedentary behavior. Now, if someone physical inactive, so if someone physically inactive, it can burn or it can catabolism the fat and also the carbohydrate storage. So the weight of the overweight or the obesity will become declined and the adipose tissue become reduced and it can make or improve the metabolic function. The improvement from the metabolic function can increase the insulin sensitivity and reduction insulin like growth factor 1 and also other chronic low-grade inflammation because the adipokine, leptin, or inflammatory cytokines such as the NF-alpha, interleukin 6, interleukin 1b is decline or reduction. And also, it can enhance the sex hormone binding globulin. It makes the cancer risk become a decline. So that's why we need to more active to reduce the cancer risk. So as the hypothesis, biologic mechanism linking physical activity, excess body fat, and sedentary behavior to cancer risk, it can lead like insulin-like growth factor 1, insulin-like growth factor um, wine, insulin growth factor binding protein, interleukin 6, TNF alpha, and also another inflammatory cytokine. As biologic mechanism, this kind of inflammatory cytokine that involved in cancer development. So physical activity can reduce this chronic low-grade inflammation, so the cancer risk become reduced. We can so one by one, like metabolic function and insulin sensitivity. As I mentioned before, that if someone low physically inactive or low physical activity, the excessive of energy deposit or store become the adipocyte. And after that, because of the accumulation of the fat, visceral fat, it makes the insulin receptors sensitivity become reduced. Insulin and insulin-like growth factor 1 as anabolic endocrine hormone, we know has important physiological role in glucose metabolism, but not only in glucose metabolism, also uh, has important role in cell proliferation, cell death, and angiogenesis. So overstimulation of these biomarkers because of a hyperglycemia, because of the uh, what we said that because of insulin resistance, so hyperinsulinemia, it makes the increase several risks of malignancies. And excess body fat, particularly abdominal fat, is positively correlation with insulin resistance. It can um, increase the high level of blood glucose, can cause the hyperinsulinemia, leading to decreased insulin-like growth factor binding protein 3 and increase the level of free insulin-like growth factor 1. And this kind of cytokine can or a hormone can promote the tumor genesis and prolong hyperinsulinemia reduced by a fiability sex hormone binding globulin and increased circulating estrogen and androgen in our plasma, so which may further contribute to tumor genesis, especially for female reproductive organ. And how about the chronic low-grade inflammation? So the accumulation of fat, visceral fat, increasing the cytokine inflammatory in a chronic period, induce or promote the chronic low-grade inflammation. Adipose tissue composed of adipocytes that secrete pro-inflammatory adipokine and cytokine that may stimulate the cancer development. And in contrast, adiponectin, which is an apoptosis-inducing adipokine that is released by adipocyte, is reduced in individuals with obesity. So if someone obese, the adipose tissue become a cell, the fat cell become increased, and the adipocyte um, from the adipose tissue, will secrete or release the pro-inflammatory adipokines and also cytokine. And the other condition, this adipocyte increase the adiponectin. And we know that adiponectin is very important, or it has a role as apoptosis inducing adipokine. So reduction of the adiponectin, it makes the work or production of pro-inflammatory cytokine like tumor necrosis factor alpha and also and another cytokine increase. So it can increasing the process of tumor genesis. What about the sex hormone? So the sex hormone binding globulin regulate the bioavailability of free estrogen, which if the sex hormone estrogen or androgen is unbound, uh, it can be considered to be highly active and associated with increased risk of some hormone-sensitive cancers, particularly breast cancer. As we know that receptor of estrogen, it is not only just in endometrium, but also in breast, ovarium, and other organ in our body, not only just in reproductive one, but mostly yes in reproductive organ, but also in another part of our body, there is also the estrogen receptor. So if the sex hormone binding globulin, which is the hormone, has a role for bound the estrogen reduction. So the free estrogen in the plasma will increase, and it can make the increasing risk of some hormone sensitivity, especially and sensitivity. That's one of the pathway why breast cancer mostly or most popular in female. And then we know that evidence from studies of cancer-free women suggests that intervention combining caloric restriction with physical activity are most effective to produce favorable changes in endogenous sex hormone. So, uh, why caloric restriction need? Because we saw that if someone get excessive energy because of excess of calorie, it will be deposit or stored on the adiposity. So the restriction of calorie will reduce the adiposity. So the reduction of the adiposity will reduce the release of estrogen from the fat cell, and combined with physical activity, this is the most effective way to changes the endogenous sex hormone. And also the androgens. Androgens has also been implicated in tumorigenesis in female prostate. Androgen and androgen receptors regulate the rate of cell growth and death, and are closely involved with the development of prostate cancer. So if the androgens in our body increase, and the sex hormone binding globulin also reduce, so the free androgens were high in our plasma, it will be stimulate the androgen receptors more, and it can make the increasing of rate of cell growth, and it can promote the development of prostate cancer. Now, what is the impact of exercise to cancer? As we know that physical inactivity is modifiable risk factor of cancer, and previous studies found that exercise and other physical activity can reduce risk for cancer. Physical activity guidelines for Americans or PAGA report, as well as by the World Cancer Research Fund or American Institute for Cancer Research, very recommended physical activity to reduce cancer risk. Because of why? Because physical activity not just important to prevent the cancer or to reduce the cancer risk, but also it has benefit in cancer treatment. As we know that cancer treatment have many side effects to body system, and physical activity or exercise that do regularly, it can defense, or it can build the positive um, impact in our body, especially for the cancer patient. If we talk about the cancer patient, the positive impact it can make the patient with cancer can be defense, or it can be a high immune system to against the side effect of a cancer treatment. Physical activity, both aerobic and resistance training, can be a choice of non-pharmacology therapy for cancer. Very so many studies about the benefit or the impact, the positive impact of physical activity or exercise to cancer. Strong evidence from physical activity to cancers. We saw that physical activity can reduce the risk of a bladder cancer, breast cancer, colon, endometrial, esophageal, adenocarcinoma, and gastric cancer. And the modern evidence found that association between higher level of physical activity with lower occurrence of renal, ovarian, pancreatic, and lung cancer. So from this evidence, we saw that physical activity is very important to reduce the risk of many of cancer. Um, Students that we know that if someone get cancer, they will have many experience because of the cancer itself or because of the side effect from the cancer treatment. So they will have experience like fatigue, anxiety, reduction from the quality of life, depression, of and some of them get sleep problem. Also pain. This experience make their quality of life is reduced. And physical activity can inhibit these kind of experiences. Just like we saw that from the previous study, the impact of physical activity on particular areas of life in cancer patients. So we know that the cancer itself, because of the tumor angiogenesis, because of the pain, continuous pain, it can make the quality of life from the patient is reduction. And also the side effect or of the cancer treatment can decline your immune system. It the treatment also make your body is not fit. Just like that, the treatment also can make yourself in pain or undiscomfort. So from the previous study, the impact of physical activity on particular areas of life in cancer patients, we saw that physical activity can reduce the side effect of treatment, such as the treatment like chemotherapy and radiotherapy. The effect of this chemo and radiotherapy can inhibit by physical activity. Then regular physical activity also can with combined with appropriate diet can reduce the fatigue. The fatigue remain decreased 1 year after intervention, and it can be very useful for patients. So when they not the fatigue reduced, they will have more spirit, more energy to do many things in their life. And also, not only the fatigue, but also increase the physical fitness, muscle strength, and body weight. So physical fitness is very important because when your cardiac respiratory fitness, you can reach this kind of fitness. More circulation, the circulation of hemodynamic circulation in your body is good. It's very good for make the treatment what we said become optimal. So when the hemodynamic is good, the reaching of the chemotherapy or um, the optimal from the treatment can get reached. And also when the patient with cancer can get the good physical fitness, they can do everything with fit and energy. They can more productive. And also muscle strength. As we know, if someone get cancer, most of time, especially when they get chemotherapy or radiotherapy, most of time they just lie down. and do nothing. If they have this situation in long term, it can make their muscle become weakness. If we do some physical activity to the patient with cancer, so it can stimulate the muscle and it can induce or increase the muscle strength. And not also the muscle strength, also the bone also, because some of cancer can make your calcium from your bone taken, so your bone become Malaysia or not Malaysia, I mean your bone become weak. And also it can increase the body weight because your appetite become or good. As we know that someone who get cancer, um, their loss of appetite because of the serotonin or because of the side effect of chemotherapy or radiotherapy. So if they have a physical fitness, they have a good circulation, and also the hormone like endorphin or other positive hormone release from the hypothalamus to the plasma, it can um, influence mood and also influence the appetite. So and also it can improve the sleep quality. So the body weight from the patient can get to back to normal. And also physical activity has impact on mental health. So the anxiety, depression to the patient with cancer can be reduction. The quality of life can increase. Both aerobic and resistant exercise can has I'm sorry, aerobic and resistant exercise can improve the quality of life by reducing the depression, fatigue, and also physical deconditioning. And more of that or mortality, longer survival can get. The mortality decrease and the longer survival can they get. And the important one is it reduce the recurrences. Um, we know that cancer is very difficult to um what is it? Cancer cell is very difficult to be eliminate. So even by chemotherapy or radiotherapy or even the operation surgical. Yes, if the stadium is still earlier, the longer survival can they get. But if the stadium two or the third stadium, they do surgical, they do chemotherapy, they do radiation, and after that they has a good improvement. But we have to consider about the recurrences. So the recurrences, it's related also from the risk factor. So physical activity can reduce the recurrences of the cancer. Combination aerobic and resistant exercise, it can reduce the incidence of metabolic syndrome in cancer survivors, which is a risk factor for cancer recurrence. So we know that metabolic syndrome, it is like obese one has a insulin resistant, hypercholesterolemia or dyslipidemia. So this kind of syndrome, one of a factor for cancer recurrences. So with the physical activity or exercise combination, aerobic and resistance exercise can reduce the incidence of metabolic syndrome. So because of this reduction in cancer survivor, the risk factor for cancer recurrences will be reduced also. Now, this is the impact of physical exercise in cancer prevention and treatment. As I mentioned before, the benefit of physical activity and exercise to cancer, not just only for prevention from cancer, but also it has benefit in cancer treatment. Molecular mechanism exercise can inhibit the proliferation that and induce the apoptosis from the abnormal cell and regulate cancer metabolism and also regulate the immune environment. So in prevention, the benefit of exercise can reduce the cancer risk, and for the treatment, it can reduce the adverse event related to cancer treatment and enhance the curative effect of cancer treatment. And as prognosis, it can be improve the cancer prognosis. This is the role and mechanism of physical exercise in cancer prevention and treatment. As we saw here, the mechanism of exercise, it inhibiting cancer cell proliferation and inducing apoptosis. Apoptosis. So, as we said that, as I said that if metabolism is abnormal, and then the cell adipocyte cell increase the pro-inflammatory cytokine, so chronic low-grade inflammation. So inflammation in chronic condition, it can induce the cancer cell proliferation. And with the physical exercise or physical activity and exercise, it can be inhibit this proliferation and inducing the apoptosis from the abnormal cell. So the abnormal cell will not grow, and the cancer will be inhibit its development. Uh, and this is the potential biological mechanism in the relation between physical activity and cancer risk. Not only both physical activity, moderate to vigorous, has positive benefit like increase the immune function, increase the total antioxidant capacity, and then increase the anti-inflammatory myokine, adiponectin, and also reduce the oxidative stress, hyperinsulinemia, and also induce the leptin, and also can increase microbiota composition. So microbiota composition is very important to our gastrointestinal, and it can reduce the risk of colon or rectum cancer. Anti-inflammatory action of muscle drive myokine. Uh, when someone get exercise, it will be muscle contraction. And muscle contraction, when skeletal muscle contraction, it can express and release myokine that has anti-inflammatory, such as interleukin 6, interleukin 8, interleukin 15, and interleukin 1 receptor antagonist. And the inflammatory cytokines such as tumor necrotizing factor alpha plays an important role in cancer promotion. So from the contracted skeletal muscle, interleukin 6 can inhibit tumor necrotizing factor alpha to release, so it can be inhibit the cancer development. Interleukin 6 increase up to 100-fold in circulation during and after physical activity. Interleukin 6 can increase interleukin 1 alpha RA and interleukin 10. And also it can reduction of visceral fat mass, one of the benefit of interleukin 15, and it can decrease of many cancer risks. And what about the hormone? Regular, moderate to vigorous intensities of physical activity influence the level of biologically available sex hormone and decrease the incidence of hormone-related cancers. Many studies have concluded that physical activity modifies metabolic hormone level by lowering circulating fat. So that as I mentioned before, the fat also can be release the estradiol, and it can reduce the sex hormone binding globulin. So when estradiol or androgen, free estradiol and free androgen, so many in plasma, it can increase the sensitivity of hormone, and with the physical activity, the metabolic hormone level can be lowering by the lowering circulating fat. And for the immune function, moderate physical activity, as we know, may enhance the immune function by increasing the number and the activity of immune function cells, such as neutrophil, eosinophil, monocyte, and lymphocyte. So innate immunity and adaptive immunity can be increased by the physical activity. And also it can increase the mitochondrial function, so it can increase the total antioxidant capacity to elimination of reactive oxygen species as a radical substance in our plasma. So because of this elimination, it can decrease the progression of human cancer. And this is the effect of exercise for several types of cancer. It has the effect of exercise in reducing cancer risk in different kinds of cancer. For breast cancer, a physically active woman has lower risk to breast cancer compared than inactive woman. And from the study also that physical activity influence sex hormone, insulin resistant, and inflammatory adipokine. So it's very important to suggest a woman to get regular exercise because in association with weight reduction, it also decreases the level of sex hormone as well as reduction the breast cancer risk. So as significantly, the reduction of estrogen and the increasing of sex hormone binding globulin will reduce the breast cancer risk. And we don't forget about the type and dose of physical activity. The type and dose of physical activity may have a varied effect. So different type and different dose it will make or will have varied effect. We will discuss in another session. And physical activity also can reduce the risk of breast cancer in women who engage with moderate intensity level. And in addition, a greater decreased risk was found for vigorous intensity. So better for us, especially, yeah, me woman, to prevent ourselves from breast cancer, we do regular exercise or physical activity in moderate to vigorous intensity, so we can get more benefit to reducing in breast cancer risk. And what about the colon and rectal cancer? This is what I mentioned is very um nowadays very common in under 40 years old people, especially male. Numerous meta-analysis found that the increased level of physical activity decreased the colon and rectal cancer risk. And colon cancer survivors have a minor possibility of cancer recurrence and improved survival compared to inactive survivors. Also, inverse association between leisure time, physical activity, and rectal cancer, particularly in postmenopausal women. In a case control study, participants who spent more than 10 years in sedentary work present a greater risk of distal colon cancer and rectal cancer compared to those who never held sedentary work. So if we are still in productive people, do more active. Don't take your time much just for sitting. For don't increase your leisure time because you can get benefit 10 years after this. What about the endometrial cancer? Previous meta-analysis found that evidence of a decreased risk in moderately to vigorously physically active women uh, can get a reduction of endometrial cancer due to reduce the body mass index. And also bladder cancer. Many cohort studies and several case control studies reported lower rate of bladder cancer for individuals with the highest level of recreational or physical activity than those who were never physically active or less physically active. And about the lung cancer physical activity also can improve the quality of life cancer patient during and after treatment, reduce the side effect of treatment, and increase survival rate of patient with lung cancer. Also induce anti-inflammatory effect, so it can improve the lung muscle strength. That's the most important. Someone with who get lung cancer, it may be impact or with the they can get the impact of this cancer due to the lung muscle strength. So they will get difficult of breathe. With physical activity, it can improve the lung muscle strength. So they can get a forced vital capacity and also vital length and increasing the tidal volume. It's very important for patient with lung cancer. Um, and at the end of this session, as the conclusions of our topic, generally, generally cancer risk factors can be modified. Even behavioral, especially behavioral, you can modify your this risk factor with modified your lifestyle modification. Start from today. Be physically active people, and also you have to choose the healthy diet. Stay away from drug. Stay away from tobacco and also alcohol. And occupational also because this is related with the economic situation or economic condition. When you have when you do a profession in high risk job with the material which are carcinogenic, please protect yourself. So and also the environment. Environment, we can avoid the environment among us about air pollutant or air pollution, water pollution. We can defend ourselves from the sun exposure, but we can protect ourselves with use masker or use sunblock or other things to get better environment. And then from the lifestyle modification, we can also control the metabolic risk factor. In metabolic risk factor, physical, inactive, sedentary, and obesity are modifiable factors. We know that several studies showed that sedentary lifestyle can influence metabolic state, promote insulin resistance, fat accumulation, release pro-inflammatory cytokine that can active the tumor genesis, and skeletal muscle fibers contraction in physical activity and also exercise give benefit effect or positive effect as molecularly can reduce the risk of cancer. Physical activity and physical activity and exercise have impact to improve cancer patient experience in several types of cancer due to physiological adaptation. Regular physical activity and exercise are recommended for prevention, treatment, and improve prognosis in cancer patients. I think that's all for this time being. Thank you very much for your attention. And I'm very grateful if there are questions from you. You can ask in interactive session. Thank you very much.